In the previous videos, I have presented the first two elements of an instructional design, namely situational analysis and learning outcomes. To review, the situational analysis gives context to the learning environment, the learners, and other factors that could affect and should be considered when designing instruction. Meanwhile, learning outcomes provide focus to the instruction because outcomes influence all decisions regarding curriculum and instruction. During our workshop, we were able to answer the questions, where are we now and where are we going? To bridge the gap between these two is the third element of the instructional design, learning activities. Good day to you. I am Dr. Abby Jennifer Tamayo Tolentino, and in this presentation, we will focus on answering the question, how do we get to where we want to go? In answering this question, we will be able to determine what are we going to teach and how are we going to do it. So in the context of instructional designing, this third element refers to the content of the instruction, the learning strategy to deliver the content, and the resources that are needed to implement the instructional design. For the content, there is no question that you are the experts. You know what to teach because by training and experience, you know what are expected of our doctors and what competencies are required in order for them to perform their professional roles and tasks. However, we have to consider existing conditions in health and education today. I am referring to first, the outcome-based education, which puts prime importance on outcomes and constructive alignment. OBE also places emphasis on the must-knows and eliminates the nice-to-know in the curriculum. Second, the Universal Healthcare Law, which reorients healthcare delivery, and in response to this is the reorientation also of the educational system to include and our focus on primary health care. The process of selecting and organizing content and learning activities are founded in certain learning theories. So the first part of this presentation will be on adult learning theories that underlie the process of designing instruction, particularly selecting and organizing content and learning activities. For outcomes 2 and 3, we will do this on Wednesday during our workshop. There are three learning theories that guide us when designing our learning activities. These are cognitive, experiential, and motivational learning theories. First is Gagne's process of learning, which starts with environment stimulation. If the learners are interested in the task, expectancy is established. And as they become expectant of what they are going to learn, they proceed to attending to it and concentrating on the task. If the interest is sustained, they will find a way to relate the present task to what they previously experienced or encountered. This is called coding. Depending on the intensity of the learning experience and the connection of the code, meaning connection to past experiences, the newly learned task can be stored in the short or long-term memory and can be retrieved as needed using the same code. Then the learners discover that the new learning can be transferred to similar situations. Continuous use of the new learning means learners perform or respond, and in doing so, it generates feedback from others. Depending on this feedback or reinforcement, the learners keep the newly learned task as is or expand and multiply them, arising to new learning. What does this tell us in terms of planning our learning activities? Number one, when organizing content, we have to sequence it in such a way that the new lesson or topic builds up on the previous one. Number two, we have to make the content or task highly relevant so that the new learning gets in the memory storage. Because those information that do not get stored becomes lost, hence the learners do not learn them. Number three, when selecting and organizing teaching activities, we have to start with those that will grab the attention of the learners and that will sustain their interest with what is to be learned. Number four, when planning learning activities, we should provide more opportunities and similar situations in order for the learners to transfer their new learning. And number five, we should also provide time for feedback or reinforcement because it paves way for further learning. Meanwhile, David Cobb's experiential learning model demonstrates that learning begins with the learner's concrete experience. When the learners are provided with concrete experiences or learning opportunities, they compare it with what they already know and reflect on the dissonance between the two. From this reflection, the learners then form new concept, and that is called abstract conceptualization. These new concepts, they will then test this in new situations called active experimentations. This learning theory supports that when planning learning activities, we have to provide concrete learning experiences wherein the learner will be actively involved and then provide more opportunities for them to test out their newly formed concepts. This is in line with one of the OBE power principles, which is expanded opportunities. And then we have the motivational learning theories that postulate that all learning begins with the learner's motivation. For most students, they start with extrinsic motivation, such as good grades, praises from their teachers, parents, and classmates, and other rewards. The challenge lies in converting this to intrinsic motivation, which produces more sustainable learning. How can we, as teachers, help our students to be intrinsically motivated? We can start with increasing the relevance of the content or task. Because if the learners understand or they see the purpose or the meaning in what is to be learned, then learning is facilitated. Summarizing the implications of these learning theories when designing instruction, learning is facilitated when the learner is actively involved, and what is to be learned is related to the learner's previous experiences. Learning is also facilitated when the learner sees purpose or meaning in what is to be learned, or they are able to apply what has been learned to actual life situations. Now, there are several ways to organize content and learning activities. This is the four dimensions of student progression from Harden in 2007. This describes several manners by which we can organize our learning activities. First, by increasing the breadth of content or tasks as they progress through the program. We can design the course in which the learners can extend their area of competence to new topics or to different practice contexts. For example, history taking. We start with letting the students know what information they need to gather during history taking and why they are important. And then we demonstrate to them how to do it. Then they practice and practice until they can demonstrate basic skills. At first, they can practice with their classmates and then with a standardized patient. Using standardized patients, we can expose the students to a complicated case or a difficult patient who doesn't want to give any relevant information but keeps on complaining of pain. So that's a different context. Another one is to ask the students to do history taking in the community, which will be a different scenario when they are doing it in the clinics. So different context again. By increasing breadth, we can also allow for application of existing knowledge or skills to a new one. The second dimension is through increased difficulty. We can design the course in which the students can progress by addressing a learning outcome in more depth. We can also introduce more complex situations or situations wherein the answer is less obvious. For example, diagnosis of endocrine disorders. At first, we can ask them to look for the signs and symptoms, the manifestations, the diagnostic results of different endocrine disorders. The next step is to give them the list of signs and symptoms and diagnostic results and ask them to give a differential diagnosis. Then we can take it a step further by giving them a textbook case in which they have to analyze, break down the material, then put it all together again to come up with a diagnosis that they have to justify. Then we can modify the case to make it more complicated. So that's increased difficulty. We can also organize content and learning activities by increasing the utility and application to practice of the topic or task. We can design the course in which the students can progress from a more theoretical understanding of a subject to its application in practice, or wherein learners can move from general to more specific contexts. Lastly, by increasing proficiency or accomplishment. Students may demonstrate increased proficiency associated with more efficient and effective performance. This may be exemplified by less time required for a clinical task or the achievement of higher standards with fewer errors and minimal supervision. Specific for the selection and organization of learning activities. Teaching learning strategies rather can be grouped according to what the learning outcomes require, the size of the class, the setting where the learning will take place, and what the learning process and principles call for. In the succeeding slides, we will be enumerating varied teaching learning strategies that we can use according to these categories. The purpose of this part of the presentation is to emphasize that the choice of strategies to deliver content requires appropriateness, alignment, and consideration of the learning process. We will not be discussing how to conduct these strategies, the advantages and disadvantages over the others. We will have a separate presentation for that, and then we will also organize training on how to conduct these strategies. So, depending on what the learning outcomes require, there are teaching learning strategies that are more appropriate if we want the students to increase their knowledge, learn a skill, or learn a behavior. For the cognitive domain of learning, teaching learning strategies can be lecture, case discussion, problem-based learning, seminars, and conferences. Strategies that promote self-directed learning can also be used, flipped classroom, blended learning, as well as team-based learning, among others. What we need to consider when selecting the most appropriate strategy is the level of intellectual ability that the outcome requires. For example, if we want the students to remember or understand, a lecture or a conference will be sufficient. If we want them to apply what they have learned, analyze, or evaluate, then case discussion, PBL, PBL will be more appropriate. For the psychomotor domain of learning, what we usually use is the demonstration return demonstration. So first, the instructor explains the skill to be learned, followed by the performance of the skill. The students are then given time to practice through simulation exercises where the students perform the skill. Among the three domains of learning, attitude is probably the most difficult to teach. This figure shows the continuum of strategies on teaching attitudes from indoctrination to values clarification. In indoctrination, the teachers tell what the learners need to do. We can impose deadlines, we can be strict with the dress code, we tell the students what behavior they need to demonstrate in particular situations. In role modeling, we show them how to act, how to dress, to be professional. We demonstrate to them how to exemplify a particular behavior so that they will do the same. In the same manner, they will see how important it is because you are doing it yourself. We are doing it ourselves. In values clarification, we let them decide on their own. We give them the autonomy in the hopes that we are able to inculcate the right attitude and behavior in them. We can see in this continuum that the degree of student autonomy increases as we go towards values clarification, and consequently the degree of teacher authority decreases. Again, among the three domains of learning, attitude is probably the most difficult to teach. And most of the time, we don't really use a particular strategy to teach it, because attitude should be embedded in the instruction at all times. But whatever strategy we use, there are three components of attitude learning, including a cognitive component in which the learners know how to demonstrate the attitude, the affective component in which they know why the attitude needs to be learned, and the behavioral component in which the students apply the behavior in given opportunities. That's for the learning outcomes. For the class size, it can either be a small or a large group. And for the setting, we consider three: the classroom, the clinics or laboratory, and the community. For a large group of students, we can plan for a lecture, a demonstration, specifically if it's a skill that we want to teach, symposium, panel discussion, colloquium, workshop with plenary, and dialogue. For small groups of up to 10 learners, some resources say that small groups can be up to 12 members. We can further categorize the strategies depending on the objective of the activity. If the objective is to generate ideas and opinions, we can use buzz groups, brainstorming, or crossover groups. If the objective is to clarify or to build consensus, we can employ tutorials, group discussions, snowballing, nominal group technique, fishbowl, or roundtable discussions. And if we want the learners to practice and or play certain roles, we can do role play games or simulation. We will not get into the details of how to facilitate these strategies and how each one is different from the others, because again we have a separate presentation for this. We just want you to see that the selection of the teaching learning strategy has to be appropriate in every aspect at all times, and that we have numerous strategies that we can use as long as they help us in achieving our outcomes. For the strategies according to class setting, again, the common settings we have are the classroom, the clinics, and the community. For the classroom setting, any of the strategies we have mentioned so far can be utilized, but we have to be mindful of the domain of learning and size of the class. For the clinical setting, we can facilitate a tutorial, case presentation, simulation, demonstration, use of standardized patient, or combination of these, preceptorship, mentoring, and rounds. What we need to consider here further is where we are in the clinical learning cycle. This is the clinical learning cycle by Cox in 1993. It shows the learning process in the clinics. Again, we won't go into the details of this, but what we want to point out here is the appropriateness of the strategy. Depending on where we are in the cycle, whether we are in the preparatory, laboratory, or clinical practice instruction stage, there are appropriate strategies that we can and we should use. And then we have the community setting. We can also use any strategies here as long as they promote direct contact between the students and the community. So that's very important and critical in if the setting is the community. Lastly, whatever teaching learning strategies we use, we should always consider what the learning process and principles call for. According to Gagney's event of instruction, every teaching learning activity should have a beginning or an introduction, a middle part or development, and an end part or consolidation. So what are the implications of this in the instructional design? In introduction, our resources and activities should be geared toward gaining and directing the attention of the learners to the lesson to be taught, informing the learners of the instructional purpose, activating the motivation of the learners, and providing an overview of the session or class. How can we do that? We can start with our outcomes. We can tell them the outcomes expected of them after the session. We can also use triggers, images, videos, or questions that can grab their attention or are related to the learners so that we can activate their motivation. We can further use games or quizzes to gain and direct attention of the learners. In the development or the middle part of instruction, our resources and activities should be able to stimulate recall of prior learning, present the information through examples, and elicit response from the learners. This is also the time that we guide and prompt them to use learning strategies like mnemonics, for example. And this is also the time we provide feedback to them. What's important here is that we promote the acquisition and the retention of information. Lastly, in consolidation, or the end part of the instruction. This is where we summarize the content and we review what we just taught so that we enhance transfer of learning and provide closure. For transfer of learning, what else we can do is we provide the students with scenarios to which they can apply what they just learned. And this is actually the purpose of our homeworks and projects. Let's keep in mind that the appropriate use of well-prepared learning resources or implementation of a well-prepared learning activity can spell the difference between an effective and a very effective teaching learning session. And since we are speaking of the consolidation stage, allow me to close this presentation by giving you the key points presented here. The selection and organization of content and learning activities are supported by cognitive, experiential, and motivational learning theories, which tell us that learning is facilitated when there is active participation, if what is to be learned is related to the learner's previous experiences, and if the learner sees purpose or meaning in what is to be learned. Learning is also facilitated when the learner is able to apply what has been learned to actual life situations. Second key point is that content and learning activities can be organized by considering the four dimensions of student progression: increased breadth, difficulty, utility, and proficiency. And the last key point is that the teaching learning strategies can be grouped according to what the learning outcomes require, the size of the class, the setting where the learning will take place, and what the learning process and principles call for. Ultimately, the choice of strategies to deliver content requires appropriateness, alignment, and consideration of the learning process. I will end here and thank you very much.